Okay, so welcome everybody. This is another episode of MedTech Trends. I'm your host, Dorian. Today we've got with us Raphael Gotlieb, who is a passionate patient advocate and medical researcher. Now, Raphael is the founder of Precare Inc., which is an innovative web-based platform providing free, evidence-based health education for patient needs. It consists of engaging animated guides available in 20 languages, which reduces dependency on printed media while standardizing and centralizing online information. So welcome, Raphael.
Thank you for having me, Dorian. Appreciate it.
My pleasure. Okay, so I thought maybe today we could start off with just a really simple question. What was the challenge that you guys identified before creating Precare, and then we'll get into what the actual service is and how it works.
Perfect. Yeah. So thank you for introducing it. You did it justice. So the idea is, that we're really a patient education platform because for the majority of my life, I've been volunteering at hospitals working with cancer patients. And that really evolved into a passion for improving patient care. And what I noticed is that communications is often a huge issue and a hurdle that clinicians have to overcome with patients from different ethnicities, different educational levels, language barriers, things of that nature. So that led me to really examine the way doctors make decisions and the way that medical decision-making occurs, because medical errors are actually the third leading cause of death in North America. And they account for over 250,000 deaths a year in the United States, 28,000 deaths in Canada, where I live. And the idea is that a lot of them are not due to a lack of knowledge or lack of experience or expertise, but rather to poor decision-making and communication barriers. So that really led me to explore, as I was saying during my thesis in experimental surgery, how doctors make decisions and how they communicate with patients. And what we realized during the research is that patient education is a huge problem because patients don't necessarily participate in their care, and therefore they're not participating in the shared decision making, which is causing them to really not retain a lot of information. So there's a lot of research that has been done, and some of it shows that patients forget up to 80% of the information provided to them in their clinical visits, and half of what they remember is misremembered. So it's just the idea that we found that the current standard of printed media and patient education is inefficient because it stretches human resources. Printed media gets outdated very quickly and sort of has a low shelf life. It's bad for the environment. There's limited language diversity and limited patient feedback and engagement. So that's really where we came up with the concept of creating very simple audio visuals and trying to provide them in 20 languages, trying to provide them as animations, as people retain more information when they do obtain audio visuals compared to just text. So it's really using psychology to deliver a message in the best way and try to empower patients to get involved so they could be part of the shared decision making. And at the end of the day, make healthcare better for everyone while reducing medical errors.
I didn't even realize just how much of an impact those kind of medical errors had on, I guess, hospital-related deaths. But it's a huge impact. We're talking like hundreds of thousands of people being impacted by this, and a lot of this is avoidable by being able to provide better communication, or better avenues for communication between physicians and patients. So a lot of avoidable deaths there and injuries.
Sure. So what I was doing during my research is actually assessing how doctors make decisions and whether it's a crisis or a non-crisis situation, how our brains think, and kind of like the cognitive pitfalls that we fall into. It's just the idea of how do we cater education to make better decision makers, which is a huge thing to kind of take head on. And we are actually just focusing on the patient education element because that's really easy. It makes people better off, and it can reduce a significant amount of those medical errors before taking on how people think and changing the whole culture of education, especially in medicine, where it has been relatively stagnant for, the past 3-4 decades. But things are changing, whether it's demographics of people applying to medical schools, whether it's the demographics of, whether it's the changes in technology and then not necessarily being implemented into the curriculum of medical school. So there's a lot of things to fix in healthcare, which is why I think podcasts like yours bring attention to medtech and, technology's implementation. At the end of the day, when it comes to decision making and empowering people, we really thought that the simplest way is to really just get patient engaged and empowered to participate in their care, and at least that will make the experience they have a little better off.
Yeah, you touched on a lot of really important topics there. So we'll get
Sorry
into,
about that.
what no, that's awesome. I love this stuff. So we'll get into what pre-care is and how it functions next. But I'm also really curious, right before we get into that, this idea of, it's one thing to just receive information. It's a very different thing to internalize it and to process it. And anytime we do that, especially with something like medical information that has a direct impact on our health, then we're also talking about, what are the different filters that people have in terms of how they interpret that information. And a big part of that is your cultural background, your socioeconomic status, and a bunch of other things that affect the way that you perceive that information and how you respond to it too. So I wonder if I can get your take, maybe even like in simple terms, but is speaking of communication, is there the cultural differences that people have, especially in a very multicultural society? As a physician, can you really interact with everybody in the same way, or do you really have to be able to cater that information to different audiences, specific audiences, knowing that culture plays a big part in how they react to it?
So it's just the idea that you really do need to customize your care to every patient, but that's very difficult for physicians that are billing by the hour by the patient, or just have a ton of different things on their mind that they have to get through, and it ends up that the nurse does most of the talking to the patient, but then the nurse doesn't necessarily communicate what the doctor what they shared. So sometimes there's a gap in shared information. And you also have doctors, the way doctors process information, right? So if you go into the ER and you have abdominal pain in your stomach, a good doctor might think of 5, 6 different alternatives before trying to hyper focus on one, as opposed to another doctor that's maybe a little bit more like newer to the field, that will just use a cognitive bias and say, okay, I've seen this happen 1,000 times before. It's most likely appendicitis or whatever he's going to assess it as, right? But he won't think of this 10% where it could be something else, and then you might be misdiagnosed. So it's just the idea that if you as a patient freak out because you have abdominal pain and the nurse asks you all these questions, but you didn't necessarily retain all the information, you communicate with the doctor, you don't deliver the information that would make your care like the best off, you could actually miscommunicate with the doctor and kind of like hyper focus on one negative thing that the nurse said, and that will actually change the trajectory of your care. So if you're a nervous patient and I'm a patient that doesn't necessarily understand what I have, and then person C is a patient that has some kind of scientific education and understands their comorbidities and all those different things that like play into it, all three of us might get significantly different care just based on the way we interact with the healthcare system and the way it interacts with us. So
Mm-hmm.
just the idea that if you come from different backgrounds, different religions, different anything, it could really change, and that could affect your care trajectory. And vulnerable communities are usually those that are immigrant populations or those that are less privileged, and they tend to be most of the adverse medical errors that occur, right? So it's just that, like, you need to be able to approach every patient for who they are and what they bring to the table, but it's very difficult as human beings to not go to cognitive shortcuts and assess people based on what you've seen, which is like a heuristic bias, right? So it's just the idea that doctors need to kind of like think of more alternatives before jumping to one that they've seen many times before. And patients need to be able to participate and prepare for their medical, like whether it's surgeries, prepare well, understand what's going to happen, be less anxious about it, be more empowered about it. So it really, like, there's a lot of things to change. And from a patient perspective, coming from different backgrounds and different kind of, like, even in the States, like different healthcare plans that might provide you less time with a healthcare professional, you really need to optimize the way that you come to that clinical visit or that emergency room or that surgical visit, and be as empowered as you can, because that will make your care better off.
This whole topic, I mean, it could branch us off into a tangent. That's a whole conversation, separate conversation to be had on that. But hence the need for services and technologies that can help facilitate that decision-making process that's really catered to each and every patient. And I think that's a nice kind of segue into what Precare is and how it works. And I'm wondering, what sparked the idea that flourished into Precare.ca?
So it's really just being able to provide the best information we can in the simplest format. So how do you educate patients in this with the simplicity of a WebMD, but with the more engaging visuals and that are evidence-based, that doctors could recommend patients to watch, or doctors could actually provide to patients, rather than like printed pamphlets that are outdated, or provide something that's in their own language that's trustworthy. So how do you create a network of trustworthy information online? You collaborate with the best experts, internationally, and you really work on every guide to make sure that it caters to that specific population. That, whether it's kind of like talking about what is HPV and what are the vaccines associated with it. And now during COVID, we've done a whole bunch of stuff for like mental health during COVID for oncology patients, for cancer patients, like how they need to prepare. So anytime there's a vulnerable community, how can we help empower them and educate them and kind of give them something that they can go back to and watch and rewatch and share with family members, and really prepare, just so they don't rely on that one visit that they're very anxious for. And that's the visit that they need to remember everything and what's going to happen when they wake up from their surgery, and when can they go home, and what they can eat and what they can't eat. So really just reduce any kind of like vulnerabilities in the care trajectory from a patient point of view. So that's where we came up with Precare, and that's the idea of like helping vulnerable communities is really where we think that, providing it in a lot of different languages, it makes a lot of good sense.
By the way, for anyone watching, you can go on the website. It's Precare.ca. It's a great service. There's already a lot of great content on there in the way of patient education for targeted specific medical procedures and very specific content. So it's a great resource, and I know you guys have a growing library of content.
Precare is a web-based platform for patient education. People are known to retain up to 85% more information as audiovisuals compared to text. This is why our team of medical experts produce patient-oriented information as animated videos, available for free in the 20 most common languages spoken in the world. We have created over 150 animations covering 25 medical fields. We provide patients with evidence-based information, which has been shown to reduce anxiety, pain, and length of hospital stay. Our guides focus on educating patients by using simple visuals in order to prepare them for their clinical visits, medical treatments, surgical procedures, and recovery processes. The main goal is to empower the patient population with quality information, allowing everyone to access the animations from anywhere in the world at any time, free of charge. Scientific development is also at the core of Precare, which is why we have 8 ongoing original studies assessing the quantitative and qualitative impact of visual guides.
Tous nos guides sont également disponibles en français et dans 20 langues supplémentaires gratuites pour tous. Au nom de l'équipe Precare, nous vous remercions pour cette formidable opportunité.
What I wanted to focus on for just a second, so you've described it as it's an intuitive, free patient education platform. And the great thing about this, and you mentioned like WebMD, so WebMD is it's a huge website. It's got tons of content, lots of text-based information, but it's difficult to navigate. There's still a lot of information on there, and it's not very interactive. It's not always intuitive. So I'm wondering, the idea of kind of going from text-based content to video content that is also written and curated by professionals within each content area of expertise, that I think that's a significant, bit of progress in and of itself. What's the process for distilling all this crazy amount of information that's available online for anybody to read into individual contents that are geared towards specific procedures and for specific patient populations? How does that work?
So the idea is that everything we do is evidence-based. And what that means is that anything that was published in the scientific literature from a protocol point of view for a specific surgery, our team and our collaborators, our experts in the field will review. So there will be a preliminary review where we assess all the information that's out there. We take the best standards, the newest protocols, and we put it together in terms as a literature review, I suppose. And then we start scripting it with our, medical writers and advisors. And we make sure that everyone keeps being involved in the process. So it really comes out as a script that's with easy language, but also reflects the best evidence-based protocols. So where that differs from things like WebMD and other websites that are, available online, is that we really only take information from evidence-based sources as opposed to kind of just provide advice. So that means that doctors can actually recommend it because that's where people, that's where the pamphlets get their information. That's where kind of anything that happens in the hospital comes from. It's really from research that has been published, that has been peer reviewed. So that's the idea of really making it easy and accessible, reducing the barriers to accessing good literature reviewed information for patients.
This is an interesting point, because if you go on websites like WebMD, and I don't know if this point kind of is specific to that service, but there's hundreds of, or I shouldn't say hundreds, there are countless websites where you can get information, but a lot of them will have disclaimers at the bottom or on some page that basically says, always talk to your physician to figure out if any of this is relevant to you, and this is meant to be informative, educational, but it's not we're not recommending this specifically for you. So for Precare.ca, is it the content itself, it's evidence-based? So I think that's a leap forward from just general kind of medical information. So that's definitely a positive of the service. But on top of that, so you're saying physicians would also be able to recommend particular videos for patients and say, this is the kind of information that you need to know to help with your medical condition. They can actually recommend the information in the videos?
Yeah, so the idea is that we also have a form of a disclaimer, just because we're not trying to replace the actual doctor-patient interaction, but a physician could actually recommend it based as kind of as a point of authority, that this is information that you need to know, as opposed to, hey, this is a website you can go check out, but make sure that you still follow the protocol that we provide to you, because we're not sure who's, admitting it or controlling it or where the information is coming from. We just know that it's popular, or we just know that it has good information that you can understand, but it's not necessarily trustworthy, and that's unethical for a physician to recommend, or a healthcare provider. So what we try to do is really make it research-based, so it can be recommended by everyone. And if you think of websites like the Mayo Clinic or the Cleveland Clinic, big hospitals in the United States, they have that evidence-based information, but they're also limited by languages and are text-based, right? So we try to be kind of our own, its own individual platform that provides good information, like Mayo Clinic and Cleveland Clinic, but just make it at a grade 6 comprehension level, because people retain significantly more information that way. Make it through audio visuals and provide it in different languages, and kind of as more collaborative efforts, as opposed to just being under one house of Cleveland Clinic doctors and Mayo Clinic doctors, which are the two best institutions in the world, right? So if you're at a level that you can understand the information that they provide and retain it, then you might as well read and do your own research on that platform. But the majority of patients need it a little bit easier. So that's where Precare comes in.
It's a really good call out too, for sure. I mean, anybody that's ever been to a major hospital, you can go on the hospital websites, including on the Canadian side as well. their websites, usually it'll be kind of split up by department, and then you can find some pretty good information. It can be sometimes pretty technical, but basically all major hospital systems that I've seen have that kind of website. And you're right, it's very difficult to digest some of that information. I mean, it's intentionally sort of simplified because anybody can go and search that information, but still it's not very actionable. It's not necessarily always intuitive. And then there's the question of, why do so many different hospital systems have their own version of whatever this thing is, whereas the same procedure is pretty much the same across North America. I'm generalizing a little bit, but the point is, like, it makes sense to kind of look for this information in some kind of centralized place, and that's partially what a service like WebMD does, is that it's centralized. It's irrespective of whatever institution you go to for treatment, or whoever your healthcare provider is. You just go there, and it's just general information to inform yourself as a patient. And you guys you're taking that step one step further.
Not to like hyper focus on WebMD, because I think it's a brilliant idea, and 25 years ago when it came out, it was revolutionary. But they do about $1 billion in revenue a year, right? So like their whole thing is advertising. And then if you're a vulnerable patient in 70s, 80s, and you're not necessarily tech savvy, it might just be that you accidentally click one of those advertisements because it promotes better care for you, and then all of a sudden you land on a page that's even less credible. So just the idea, like, you really want to try and pinpoint patients to good information, which is why the internet's like the wild, wild west, and doctors just keep everything internal. But if you can create something that's kind of like not necessarily controlled by one institution, but it is a collaborative thing, then that could be a resource that people send their patients to. And then that could also be a resource that customizes things for your hospital, but keeps a standard of excellence to a certain degree, right? So we're not necessarily at a point where it's a household name or every hospital institution is using it, but it's really about building credibility, building a library, and trying to help as many patients. And the more guides we make, the more patients watch them, the more research we can do to assess, how patients retain information, the impact of audio visuals for patients, the impact of technology in patient education, now that our whole world is a little bit flipped upside down and patients can't really go to hospitals as frequently, or inpatient teachings. So it really is just a platform trying to provide information the best way possible and grow from it, but never actually advertise to patients or never target patients with paid ads or anything of that nature, just because that could add a whole other layer of complexity and untrustworthiness in our platform that we would never be interested in.
We'll touch on the customer system, the customers, and the hospital systems and clinics, and who else is involved in actually using Precare, and the way that the people can be actually using the service. But I'm also curious, just to kind of rewind a little bit. So it's an evidence-based content creator, and I'm wondering, the people that are actually writing the information, are they clinicians? Are they researchers? And like, how big is that team?
We really thrive on collaborations. So everyone that does write or does do the research are healthcare providers. Most of the time it is clinicians. There's a lot of collaborations with nursing. There's a lot of collaborations with medical literature writers. So there's a lot of things that happen when we develop guides. The beautiful thing is that it's mostly collaborations with big departments, with, the department chief wants to do one thing, and then he'll assign 2-3 physicians to work with us, and we'll develop like the best guide we can, and then it will go through various steps of approval and edits before it gets recorded and transcribed and brought to fruition. The core of the team are actually Dr. Senator Dogan, which is the voice and the medical, I guess, executive of Precare. And then Dr. Gabriel Schnittman, which is the scientific officer of Precare, and he also controls the animations and the visuals. So everyone in the core of the team is obviously a few more members, but like, they really make sure that at every level, even the animations are being done and developed by a surgeon. So everything at every level is kind of like catered to patients from a healthcare provider point of view of expertise. So the team, I would say, is about 4 or 5 people. There's Ben Segev, that's the chief creator of content that, helps us with like the vision, the website, the graphics, all those things. But it is really just about collaborations and different physicians or different clinicians wanting to develop guides and doing research projects and assessing things and, publishing on the way that we make them and the results from patients and patient feedback and testimonials and improved care and like really tracking all those things.
How long has Precare been around for, or how long has it been since launch?
2 years. So
2
we
years.
launched in July 2018, and just very organic, kind of like just working one guide at a time and just trying to scale it, but in a way that's sustainable and without kind of like infusions of investors or anything of that crazy entrepreneurship startup life.
Right. So very much bootstrapped. Okay. And like customer wise, have you guys already worked with a few hospital systems or medical practices?
We work a lot with the government of Canada. So we we have platforms in collaborations with the Patient Safety Institute of Canada. We work with, I would say, about 20 academic hospitals in Canada. We make content for the African Health Organization, which is, a nonprofit. Just really anything that can kind of like help vulnerable populations. We're mostly based in Canada. We have things happening in Brazil. We have things happening in Mexico that we're helping out in. So the customers, I guess, would be over 100,000 people have access to guides at one point or another, whether, for a variety of different guides. And then from partnerships with hospitals, I would say about 20.
What's been some of the feedback that you've gotten from customers that you've worked with so far? What do they like, and then what are they kind of recommending as things to improve upon?
Customers is a tricky word because customers are actually healthcare providers and government healthcare groups and things of that nature for the moment. Customers in terms of the end user, which is the person we care about most, is the patient, right? So the testimonials and feedback have obviously been, not obviously, but have been very flattering and positive. The idea, like, let's say you used to have in one hospital in Canada a once a week session for orthopedic patients that they would come learn about their operation, and would be an hour and a half session, and it would cover 6 different operations, right? Since then, we developed 6 different guides that cater to those operations, and patients can watch it from home and they don't have to come in. So this outdated platform that's been running for 20 years in person needed 6 healthcare professionals to, spend an hour and a half, needed orthopedic patients that have mobility issues to come into the hospital, look for parking, kind of like listen to like different surgeries that don't necessarily apply to theirs, and try and retain the information that's for them. So during those sessions, when we launched them, we actually had a lot of patient feedback and testimonials. And whether it's a patient that says like, they're from India and they really understood the guides because they're able to turn it on in their language and read the subtitles and share with their kids and like really prepare and feel like they're ready for it. Or whether it's a patient that says like they're going for a hip replacement and, mobility has been a significant issue for them. So they're so content to be able to watch it from home and they have no follow-up questions. So just like really kind of like you get like comments from all different fields and kind of like things that you wouldn't necessarily expect at first. So from a patient point of view, they really like it. We've conducted research also in Brazil and in head and neck surgeries where it's ongoing, but the feedback has been 100% positive. From a clinician point of view, it's very nice for them because they get a more educated population. They get to provide a service that patients appreciate. So they feel like because it's like they feel like it's kind of like made for them, or like their clinicians going the extra mile to provide them a guide that's more visual compared to just like a big text, like a pamphlet that has corrections in it and like extra papers just because like page 6 got outdated, so now you have to follow this protocol. So it's just the idea that clinicians also feel from our experience that they're providing a premium service to their patients that their patients see as a premium service. So kind of like makes the patient clinician dynamic better off. And then it standardizes the information for the anesthesiologists, for the people that are perioperative, that are, are providing information to patients from 15 different faculties. So if they know that that department is collaborating with us, then they know that the dietary restrictions provided to the patients were standardized for the best practice, which is what they would ideally like to deal with or to, have patients follow. So it's just the idea that you can start standardizing information, and it's not just, okay, wait, did the resident yesterday that has only been on with me for a week, did he actually share the information he was meant to? Wait, did he didn't write it in the folder in the patient file. Did they actually receive that information? Let me call the patient. Oh, they're not answering. They have their surgery in 3 days. Okay, we go along with it because there's a 6-week backlog, right? So, and then like they get to their surgery, they might have forgot something or not actually been provided information. They're going to perioperative. They're being provided information on how the anesthesiology is going to work. They're really nervous. They're just going to like, yes, I understand. They might not understand. And there is where a complication or, prolonged recovery might happen just because of a little broken telephone. So just if you can standardize the information, then clinicians are happy. And listen, we're just at the start. We don't have huge numbers of data, but we're certainly getting there. And the preliminary stuff that we do have is very promising.
Thanks for correcting that too. Yeah, there's I've had a chance to talk to a couple of healthcare company founders and CEOs where there's this the use of the word customers or accounts or those kind of business terms. But you're right. At the end of the day, I mean, we're talking about physician end users and patient end users, and ultimately that's what the entire healthcare sector is really kind of about. Is like getting physicians to treat patients in the most efficient and practical and easy way possible, and patients to get back to their normal lives and thriving. So the use of it's just a term, but I think it does make a difference in the conversation.
Put it this way, it's also an important term, right? If you have a viable business that you want to be able to scale, you need customers, you need product, you need results, you need opportunity cost that you're improving, you need all those things, right? It's just when we say customers, it's interesting because we cater to patients, but it's actually the physician or the healthcare groups that are our customers. But we don't necessarily, if we bring value to our end user, then the customers, which are our collaborators, will come and want personalized guides and will want us to create platform for them and wants to create like website portals for them. And that's, again, something that we'll get to, I suppose, but like that's where our revenue comes in. So while everything is free for patients, we do customize things for healthcare institutions, and then that allows them to provide a customized offering specific for their patient population, and it still follows the standard guidelines. It just makes it more custom for their patients. So like, let's say if you're a patient A at hospital A, you know that you need to show up to your clinic, which is located here. You have the phone numbers for the rehabilitation clinic or the perioperative clinic or your doctor or your department. And then you actually, as a healthcare provider, don't actually need to, give them pamphlets just because all the information is already in the visual that they could take home, they could watch, they could print key slides from, or they can print like their abbreviated version of what they need to know. So it makes the whole thing easier, and you can email those things with the appointment and kind of go paperless and make sure that, you can even track like when patients are watching it and what language they're watching it, how many times they watched it. So just really make sure that what you're communicating to them is being perceived, and then you can have a better, more informed conversation about it in the clinical visit or in the perioperative clinic.
We'll touch on the free version content versus the version that allows customization for particular departments and particular providers, and what the business model is around that piece. But I'm also really curious because from everything that you've said so far, it sounds like there's a huge potential for Precare to impact workflow as well within the department, because there's a chance to educate patients, to potentially save time from the provider side, instead of having 5-10 different people explaining what the procedure is going to be like, and sort of reassuring patients as they go through the hospital or whichever part of the healthcare system they're accessing. There's time savings that could be involved as well, and then post procedure or post discharge, there is potentially better satisfaction, potentially better outcomes, and then the follow up could also be improved as well. So there's like it sounds to me like there's a workflow upside to doing these kinds of videos as well.
I guess the people that most benefit from the service after patients, I would like to think so, are nursing or nurses, because they're actually responsible for the majority of the education and standardization of education. And in Canada and in the United States, nursing is actually in high demand because there's just not enough in the system. So if you can relieve some of the burden of the systematic repetition of information from A to Z, and just make sure that the nurses can better utilize their time with the patient that they do have, and kind of talk to someone that already has a base foundation of the information, you're actually optimizing the workflow from that point of view, from that element. And then for residents and trainees, if you actually show them a standard of what the information that is being provided is, and then what patients need to retain, they can have a better conversation with the patient when they're taking down their history or they're asking them questions. They know what foundation the patient already understands about the procedure. So they could also, have a more standardized approach to it, seeing how they keep changing. It's tough to keep track of, what resident is communicating in the way that you would, or what resident you need to re-ask the questions after they leave. So if you standardize the whole flow of information, you're most likely going to be better off as a system, as an ecosystem.
It has huge implications. So I hadn't quite thought about it that expansive, but yeah, the implications I think are pretty big. That's pretty cool to hear. All right, so Raphael, getting back to this idea, there's the free content that's available, and again, for anybody watching, definitely go and you can check out Precare.ca. A lot of great video content there. Anybody can kind of get up and running and using this type of thing right away. And then there's the second part of it, which is the paid service that allows for providers and hospital systems to cater information to particular departments, procedures, providers. Let's dive into what some of those distinctions are, and what will be the process for people to actually pay for this kind of service.
The whole idea is that we're really kind of planning now and growing into building portals for hospitals where they could have their customized content for their patient population, and that they could have a feedback loop with their patients through the portal. So let's say if you have an orthopedic clinic that we're hosting for you online, then you can also have a pivot nurse communicate with patients, so they don't actually have to come in, and based on the guides, they can ask questions and you can kind of answer them depending on priority or things of that nature. So you can actually go virtual with clinics. And then for patients, they could always, like any patient benefits when we do stuff with partners and pay collaborations, because that just means that we're creating more content that will become free on the platform. But it also means that patients of specific institutions can actually watch guides catered to them, and that is cost saving for the hospital, because that means that they don't have to print how to access the clinic and where to go, and on the day of the surgery you need to talk to this. You can already have all of that centralized online. So we don't necessarily have a pricing regimen yet. Everything we've done is more or less for free, unless it's endorsed by national medical societies, or we're creating a guide for a department that wants us to develop it for them and with them, so they will have a specific budget for it, because that's the budget that they would allocate otherwise to their printing pamphlets, and we're replacing those for them. But it really is just about growing the offering that we provide for everyone, while customizing it for institutions that it will make sense for them to pay for it. So the more reach we have, the more we're able to help society, the more we are able to help patients, the more it makes sense for healthcare institutions to customize the information for their patient population, which at the end of the day is cents on the dollar for what they are doing for patient education, patient engagement, and that's without taking into account quality of care, quality of life, and potential reduced medical errors, which in Canada at least are about $7 out of every 100 spent in the economy. You have about like 7% of the GDP going towards trying to combat medical errors or the cost of medical errors.
At this point, you've got about 20 plus institutions that you're working with or partners that you're working with, 100 or so thousand end users that have used the platform and or visited the website. I'm wondering what your vision is for the, I guess, the near term future for Precare.ca. Are you looking to grow a lot of content, bring on some new partners, new institutions, or are you trying to seek funding to turn this into something even grander, to scale up? What are you looking to do?
It really is just about creating a lot more content and, like, I guess, capturing the potential that it has at a bootstrapping level. I think that, like in 2021, we're looking to hire a few more people full time and really expand the operation and be able to collaborate with partnerships internationally and really kind of like sign up, a few hospitals to be able to use the portal that we will create for them. And then through research, show the value and show kind of like the cost savings and quality of life improvement and quality of care improvements. So really turn it into a scientific operation that makes sense bank from back, also from an economics point of view, from an administration point of view, from a patient point of view, obviously. So that's something that we are looking to do and we are actively, I guess, preparing for and starting to do. And then raising funds will be something, within the next 24 months that, if all goes well, will be a natural transition, because we will want to scale and we will want to have a whole team of developers and we will want to be able to expand our reach and our platform and, be able to cater to more communities and healthcare institutions and just be able to do a lot more cool stuff. Mm-hmm. So that's something that will come, but we're not in it for the sake of let's scale and see how high we can reach. It's more like, let's do the right things at the right time and then hope that it makes sense, hope that it's well perceived, and then from there keep going up and up and up.
The last point that you mentioned, yeah, definitely really interesting. So I've had this kind of related conversation with a few other healthcare founders and CEOs, and it's this idea of when you're taking on a healthcare venture like this, it's sometimes difficult to get it up and running. It requires quite a bit of convincing, and I think in a unique way. So if we're talking about like an evidence-based product or service in the healthcare space that can benefit a lot of end users, physicians, patients, and hospital systems, you've got to generate a lot of evidence. The quote unquote kind of sales cycles for this type of venture can be quite long. But on the flip side, the benefits can be quite huge. And it's really just a matter of, can you put together a really strong case for using this kind of service? And a lot of that comes down to, do you have the scientific proof, so to speak, to demonstrate that this thing really works? And that's something that grows over time. But the end goal for a lot of these people is not to, do the tech kind of, crazy scaling and exit type of thing. That's not the path that they're on. It's really, can you provide a lot of value to patients and providers? And that's something that shows over the long run. And, are there a lot of people that can benefit from using this kind of tech, and does it really advance healthcare in doing this? And it kind of sounds like you're sort of on the same path of, you're working your way into building up this evidence and demonstrating that the product really works and is cost effective and benefits a lot of people in the healthcare system. And then the scaling up process might be like a gradual sort of thing, almost like a byproduct of just offering a great service. And maybe that's a different angle than a lot of, like, this is like not a traditional kind of tech company. Tech companies like I don't know what a great example would be, but this is not like a, just seeking huge amounts of money for investment, growing something quick, and then sort of exiting. This is something that has huge social value, and that requires, I think, a different approach than a typical sort of tech type company. It's just a general comment, but it's an interesting topic, I think, in a lot of ways. The evidence part, in particular.
The idea that there's a healthcare ecosystem, and that if you try and talk about everything that's associated with the ecosystem and how you're going to affect it through a ripple effect of better patient education, then you can go on a tangent and say 100 different things that will be impacted, but that will be overwhelming and too ambitious to chew on. But if you start scaling very, very slowly and say, okay, first I want patient satisfaction and patient empowerment, that we already have some good proof that that's happening. Patient empowerment and patients are being happy, patients are satisfied with the way we provide information to them. Then, okay, are providers happy with their patient quality of satisfaction, quality of care? Yes, they are. So that's another thing. Then are we saving some time in printed media costs? Yes. Okay, that's a third thing. So it really is how can we impact at every level, starting with the patient as the main actor in this ecosystem, but acknowledging that it has implications that are far-reaching the patient quality of, empowerment. Mm-hmm. So it really is just we would love to scale it and be a household or a hospital hold thing that gets integrated into every patient interaction. Is that realistic? I would like to think so one day. Is that realistic in the next few months, year, 2 years? Probably not. So it really is just about scaling it and building the foundation for a way that it can support whatever, the next level will be. But it's doing it in a way that's not building a house of cards.
And as you're partnering with more institutions and you're having more people actually use the service, are you collecting information about, feedback from end users and the kind of information that you would need to demonstrate its effectiveness and cost effectiveness? Is that part of the plan?
We have a few ongoing research projects that are ethics approved and integrated within the hospitals. Just the idea of retaining the way and randomized trials where patients get the norm, which is a few printed media and kind of doctor interactions, and patients are then other patient populations get to watch the animations and have the same interactions, and preliminary results are overwhelming in favor of the multi-visual guides. And once you start publishing something like that, then the next publication will take it a level higher and a level higher and a level higher, and soon enough you're showing that there's actually cost savings from integration of multimedia web-based audiovisuals, and there is cost savings from improved care, and maybe you reduce discharge time that patients spend in the hospital, which makes the whole ecosystem better off. So there's a lot of positive that comes out of it. It's just a matter of how you assess and prove all of it, and then at what points do you capture it, and kind of at what points you can improve your impact in the ecosystem.
Have you guys been able to publish anything yet, or is there anything immediately sort of in the works anticipated to be published?
So we have 3 manuscripts that are being sent for publication now. They're more general information about the value of audiovisual and patient education, and a few things in the COVID era, how to educate cancer patients. So we give a whole kind of a breakdown of what has been done, what needs to be done, what we're doing, things of that nature. We have Dr. Gabriel Schnittman, which is a surgeon, conducted his thesis on Precare, so the idea of providing multi-visual guides in low-income countries. So he did it in Brazil, and that is something that he's publishing in the next few weeks. So his thesis results are very, very promising, showing how patients actually benefit from the idea of being more empowered through these audiovisuals in their own native tongue and things of that nature. And then we have a few ongoing research projects that are more based in a Canadian cohort of how people perceive or how they're impacted by the guides in their healthcare trajectory.
So we'll keep an eye out, and hopefully you guys post some of that stuff on the Precare website and on other social media as well. So we're coming up on time, but there's a little bit about your the process of how you went through this thinking of creating Precare that I wanted to get into. And you'd mentioned that I think this was probably relatively early on in Precare's history. You were going through one of the I guess they're an accelerated program at McGill. It's the McGill Dobson Center for Entrepreneurship, and you guys ended up winning the social enterprise first place prize. And I'm wondering if you can kind of take us through that. What was the motivation for getting into that competition, and was that sort of the precursor to Precare?
The competition we actually won a few weeks ago. We applied like about a year and a half ago, but because of COVID, it just kept getting extended and extended. It's the idea of how do we show through a business approach the value of what we're doing. And we decided to challenge ourselves by applying to the social impact or social enterprise track of that competition. And the idea is that it's the biggest entrepreneurship competition for sure in Quebec, if not in Canada. And it's just one of those prestigious things that if you can, emphasize your business case and your impact and the scalability, then you're onto something, or at least I would like to think so. So we were very proud and fortunate to have won that. And now it is really just about the idea of how do we keep proving the platform or the solution from all different elements. Because for patient benefits or for the way patients interact with it, I think that's a very easy one. I think, just from a humane point of view, people really enjoy it. People like it. They prefer it to printed media. That's not a hard one. From a hospital ecosystem, we still need to do a lot of research to actually show tangibles, but there's a good consensus of, yes, this makes sense. From a business point of view, the fact that you don't want to advertise, the fact that you don't want big corporations or big money or whatever it is behind it, doesn't really make sense. But if you actually build enough social impact, then you will end up customizing a lot of different solutions for different hospitals and become the voice of authority or, the voice of reason in patient education. People will come to your platform and will want customized solutions, just because if they were able to get it elsewhere, you're literally charging pennies on the dollar because that is your expertise now. So you can actually replicate things in a very efficient manner and very cost effective. So from a business point of view, it starts making sense if you keep growing and growing and growing and people are actually utilizing it. And then from an entrepreneurship point of view, if you're able to scale the platform and kind of get the 3 ticks on all those 3 components, then you have something going on, right? So just the idea of how do we keep challenging ourselves to grow, but not challenge ourselves out of ego just to scale and then, realize that we're now strictly a for-profit.
I'm really curious on that point too. What qualifies as a social enterprise?
Anything that attempts to create the most impact for society, and it's not necessarily a profit or a non-for-profit, but it just has societal impact or societal benefits at its core. At least that's the way I understand it, but there's different definitions.
I mean, at the end of the day, you can't have a profitable healthcare company that also offers huge social benefit.
Yeah, and where I believe, when it came to the finalists of the social impact track, we were probably one of the very few that were a for-profit as opposed to a not-for-profit. But here, the more profit we're able to make, the more we can reinvest and kind of generate growth in the company. And that, the more social impact we make, the more profit we make, and kind of a vicious circle that we're trying to create by maintaining the patient at the core of everything and building around it. But if you look at patient engagement pre-COVID time and patient education, it's scaling to the tens of billions over the next few years. And now it's even accelerating more, right? So there's a huge opportunity where patients are getting more empowered and more engaged and seeking more information outside of their, clinical visit. And we want to make sure that that information is sound information that can actually be recommended to them, as opposed to just searched on Google and just landing on something that looks credible but might not be.
Yeah, and to that point too, I mean, I can't think of another resource that's as, I think, dedicated to this particular niche as you guys are. So, and I find it extremely useful, not just from personal experience. Everybody at some point will end up going through the hospital system or clinic in one way or another. So I would find this extremely useful, but I'm also thinking of, my parents and my parents' generation, how much it could help them. So I see huge social value to doing this and to be able to scale it too, which I think is a necessary point. I wonder if you can also take me back to like over the last, two or so years since Precare was founded. Is there anything that stands out to you in terms of, challenges or barriers that you faced in getting this thing up and running? And maybe this happened more than once, but is there anything that really kind of stands out to you as being something that you really had to overcome?
Well, the idea is that I've heard it, said once or twice in these entrepreneurship talks or podcasts or different things, but it really does ring true that you actually don't have an agreement until you actually have the agreement. You don't have a project or a budget until it's actually signed, and then that's even that at that point is a whole other headache. So don't rely on things just because you had one or two good interactions with someone. Make sure that you're actually planning in a realistic way and not relying on too many exterior factors, because more likely than not at the beginning phases, if you're not, convincing someone that they will benefit from what you're doing, it could be a great idea, but like it's not going to be on top of their to-do list. So it's just the idea, like you talk to so many people that get excited, oh yes, let's do this, let's do this, let's do that, but it doesn't actually end up panning out. But all of a sudden you're planning because you just assumed that it was going to work because they told you it was going to work, and they reassured you a couple of times. So it really is just take everything with a grain of salt, focus on what you're doing, and don't get too distracted by things that are not concrete or, signed off on in a tangible and kind of like an authoritative way.
Makes sense. It makes sense. And I'm sure it also helps having like a solid team to work with, to back you up and to help you make decisions going forward. So is there anything special about the team that you've been putting together and the folks that you've been selecting to work as part of Precare?
So I already mentioned Senna and Gabriel. There are people like Dr. Jeffrey Howe. There are people like Ben Segev, which is our creative guy. There's just a whole bunch of friends that are involved in the day-to-day. And it really is just about getting people with a similar vision, because kind of like even like none of us necessarily have the exact expertise that we've developed over the past few years, but it's about like having the right people and them evolving into the expertise or becoming experts in the field, as opposed to having experts but are not necessarily the right fit. Because if you're looking at kind of like a social enterprise, or if you're looking at a small business that's not looking to raise funds within its first year or 2 years, or it's not looking to like be significantly profitable in the first 1 to 2 years, it's very easy for people to fall off. And then those are people that you can't come to rely on, but you can't necessarily replace them, A, because it takes too long to train, B, because the cost of replacing would be too high. So it really is just about getting the right people. And that's something that just came really organically, because these are the people I associate myself with. These are my friends. And then this is something that we all have a shared interest and an invested, I guess, passion in seeing come to fruition. So it really is just more in a sense of a passion project rather than a business in the way it operates, but it has a lot of business potential and, kind of like revenue generating, not potential, but like, I guess, ways that are very easy for us to now see. Mm-hmm. So it's exciting because we're driven by the right things, but it's also exciting because we see an opportunity in it that it will generate revenue in a socially impactful way. which is the best of both worlds for us.
It helps sometimes to not have your eyesight completely on just the end goal of turning this into, you know, a big kind of impactful social enterprise or business, or a combination of the two. And when you're talking about people that are very passionate about the product and the company itself, that see themselves using it in their own practice each and every day, that makes a big difference in helping to incentivize and to motivate people in a way that, you know, just the more traditional kind of incentives are, you know, lacking in some extent. So I definitely look forward to seeing you guys keep building Precare over the next couple of months and years, hopefully with a good, you know, influx of support as you guys need. And yeah, I mean, this is really thing that can be of huge benefit to end users, both patients and providers, and have like enormous consequences, positive consequences, I think, in the end. So Rafa, I think at this point, what I'll do is I'll pass it on to you if you have any kind of final key messages or keywords you'd like to share with the audience, and then we'll pretty much wrap it up at that point.
Dorian, I really appreciate your time. I think that this is a great podcast, and much like all good things that have social impact, it's difficult to scale at first, but the implications and kind of the potential of it is super beneficial to society. So as Precare scales, I hope that everything that you endeavor in scales as well. And that, you know, we were able to have this chat in a few months and kind of like look back at this journey and see what we've done and the right things and kind of like the impact that we're able to provide. So cheers. I appreciate your time, and I look forward to our next chat.
I mean, I would definitely like to have a follow-up chat as well. I think that'd be pretty awesome. For anybody watching too, so we'll put a link in the description. Precare.ca is the place to go, and then we'll see if we can get some additional links and contact information from Raphael in case anybody wants to get in touch with the company directly. So thanks a lot, Raphael, and I wish you all the best.
Thank you.